Hi everyone, Dr. Steph here. Welcome to our series on the multiple causes of diabetes, type 2 diabetes, and in some cases type 1 diabetes. In previous videos, Dr. Tom talked about some of these other ones here, food sensitivities being a cause of diabetes, gut health, as well as liver dysfunction. Today what I want to do is I want to talk about a very important issue related to potentially causing diabetes, and that is toxins. And there's multiple sources of toxins. In this particular case, I'm talking about environmental, man-made toxins. There are other toxins that we can get exposed to that are sort of naturally produced, which we'll get into in another video. But there was an important research paper published in Integrative Medicine back in August 2016, and what the title was, is the diabetes epidemic primarily due to toxins? And what this paper did was they actually showed with graphs, overlaying graphs, they showed a very strong correlation to the introduction and increase in environmental toxins like pesticides, heavy metals, other chemical pollutants in the manufacturing process. Overlaid that increased graph with the epidemic of type 2 diabetes that we've been seeing going up in the last 30 plus years, and it's a very, very, very strong correlation. What they did was they looked at toxins like arsenic, which is found sometimes just in your water, city water in particular, BPA, which is bisphenol phosphate, and I've done a whole video on our YouTube channel on plastics in plastic bottles and avoiding plastics and the importance of that. I also did a video in our thyroid series on how BPA is a contributing factor to thyroid disease, but BPA in particular blocks insulin receptor sites. And so as a type 2 diabetic, you have insulin receptor problems, you have insulin resistance, and what we know is that BPA actually is a very strong contributor to blocking insulin receptors and causing insulin resistance. So yes, eating too much sugar also does this, but it is even more amplified by the exposure to BPA. They also looked at other things like phthalates, certain chemicals that are in like new furniture, like flame retardant sprays and things like that. All of these chemicals have the ability to either block insulin receptors or prevent and inhibit your pancreas from secreting insulin. So almost making you act like you're a type 1 diabetic and not produce enough insulin. The good news is that these chemicals can be avoided. These chemicals can also be eliminated. It takes work, it takes diligence, detoxification protocols, certain supplements really help with this, but I want you guys to just be aware that it may not just be you ate jelly beans and your sugars went up. That may not be the only underlying cause of your diabetes. Looking at chemicals in the environment and are you building them up in the system could be one of those contributing factors. Now, as far as knowing if this is actually happening to you and is something that needs to be addressed to reverse your diabetes, fortunately we do have testing available, and one of the tests that we do is a comprehensive urine test that allows us to assess several different environmental toxins, and we're also therefore able to do protocols with our patients if those are extremely high and likely causative for their diabetes, and then we can actually post-test and make sure that we're eliminating, and you can also see your sugars coming down and hemoglobin A1C coming down, knowing that these things are working. So not all hope is lost, but it's very important to understand that sugar in the diet is not the only cause for diabetes for many people. I hope you found that helpful. Stay tuned for some of our other upcoming videos addressing the other 15 different common causes that we find for type 2 diabetes.